Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on S. 1086.
Without objection.
Mr. Speaker, I rise today in strong support of S. 1086, the Child Care and Development Block Grant Act of 2014. I yield myself such time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. Mr. Speaker, across the country, countless women are trying to build a better life for their families. Some are working more for less in order to make ends meet. Others are pursuing a degree at a local university or improving their skills at a nearby community college. Whether going to work or school, most parents face a difficult question. Who will care for my child? Is there a trusted child care provider who will keep my son or daughter safe? And if there is, can I afford it? For nearly two decades, the Child Care and Development Block Grant Program has helped low-income families answer these tough questions. The program funds state efforts to provide vulnerable families access to child care. Parents receive assistance in the form of a voucher or certificate to pay the child care provider of their choice. Approximately 1.5 million children under the age of 13 are in a child care arrangement funded through the program, including over 25,000 children in my home state of Minnesota. It is a vital safety net for moms and dads trying to lift their families out of poverty. At a hearing held earlier this year, one witness told the story of a woman named Rita. Speaking of the Child Care and Development Block Grant Program, Rita said, quote, "These federal investments were quite a serious lifeline for me. I know where I came from, and I do not want to go back," close quote. Rita's experience is shared by many Americans, yet despite the importance of the program, it has been almost 20 years since Congress reformed the law. As with any federal program left on autopilot, problems will emerge, and this program is no different. Poor coordination across related services and a lack of information make it difficult for parents looking for the best provider to know the full range of options. Perhaps most troubling, a patchwork of state licensing, monitoring, and related safety requirements means some children aren't protected like they should be. These families deserve better, which is why I am to support this important legislation. The bill before us includes a number of common-sense reforms that will strengthen the program and our support of these at-risk families. For example, the legislation requires all participating child care providers to undergo, at a minimum, an annual inspection to ensure compliance with health, safety, and fire standards. The bill enhances existing training for providers and their workers so every child is under the care of a well-trained professional. The legislation also reins in the authority of the Secretary of Health and Human Services to prevent this and future administrations from writing onerous rules that would limit access to this important service. Mr. Speaker, we have a long way to go before every American enjoys the opportunity and prosperity they and their families deserve. By supporting this bipartisan legislation, we have a chance to help these families succeed and set their children on the path to a bright future. Before closing, I'd like to recognize a number of my colleagues who helped make this legislative achievement possible, including Senators Tom Harkin and Lamar Alexander, the Chairman and Senior Republican on the Senate Health, Education, Labor, and Pensions Committee. I'd also like to thank the Senior Democrat on the Education and Workforce Committee, George Miller, and Representatives Todd Rokita and David Loebsack. Last but certainly not least, Senators Richard Burr and Barbara Mikulski laid the foundation for the bipartisan, bicameral agreement we are discussing today, and we're all grateful for their years of dedication to this really important issue. Finally, Mr. Speaker, we would not be here today were it not for the hard work and dedication of our staff. I wish time permitted an opportunity to recognize each and every one of them. We are forever grateful for their service. I urge my colleagues to support this legislation, and I reserve the balance of my time.